Hello, everyone, and welcome to Our Ventura TV. I'm Sandra Siepak. On today's show, we're welcoming Jill Shaffer. She is the Community Engagement Manager for the Unite Us organization here in Ventura County. Thank you so much, Jill, for joining us on the show.
My pleasure.
Very good. Tell us more about this organization, Unite Us, and what you and your colleagues do for so many people here in Ventura County.
Wonderful. Well, Unite Us, it's about a new model of care driven by the community. And Unite California is this true coordinated care network of health and social care providers. Partners on the network are connected through a shared technology platform, which is Unite Us. And it enables them to send and receive electronic referrals and addresses people's social needs and improves health across communities. Unite Us has partnered with communities in over 44 states to build coordinated care networks. And one important part of what we do is connecting people to services, but the core focus is coordination, where every organization, healthcare, government agency, or nonprofit is connected together around a client in need.
Terrific. I know that there's many things, many arms of the organization that help so many people. But I'd like to talk about one term I've heard, and this is something I'd like you to clarify for viewers about social determinants of health. And if you could kind of go into that and talk about that and how it affects people.
Absolutely. So for many people, when they think about health, they think of healthcare, like in a clinical sense.
Right.
But Unite Us was founded with the idea that health lives in the community. And because we're all serving that same community, we all need to be here at the same table. Mm-hmm. Health happens out in housing. It happens in different clinics, in schools. It happens in churches. There are people all over out in our community that don't have access to care, and they don't know what services there are out there that are available to them. I mean, we have over 3,000 nonprofits alone in Ventura County wanting to help and serve people who need their help, but no way of really connecting and communicating these people with the help that they could utilize.
Okay. How does Unite Us support many of these nonprofits that you work hand in hand with to help people that need those services and help along the way?
Right. So Unite Us is a nationwide organization, but we have a lot of healthcare partners. Kaiser is one of them here locally, the big Kaiser Thrive initiative that helps, and as you can imagine, funding because it's very advantageous for healthcare providers to have a preventative healthcare out in the community, right? So we're connecting now with social service agencies. So they are investing in this opportunity to make healthcare and care and social care issues much more streamlined and efficient, and it saves them the bottom dollar, but also it really just improves and elevates communities. So I mean, as organizations plug into the existing referral network, they have data that can demonstrate an impact. There's so many different pieces of this pie that it improves, but generally we do have support from a lot of healthcare providers.
Okay. What would you say are some of the barriers that you are seeing for those people who need special access to social services, especially here in Ventura County? I'm sure you have seen that, and I'd like you to kind of expand on that a little bit.
Absolutely. Well, we are, again, like we talked about with all the nonprofits in Ventura County, but people are really trying and wanting to be able to connect, but are struggling. We talk a little bit about health equity, where everyone should have access to healthcare. Everyone should have access to the same care. And how do you do that if there isn't an overall arcing coordinated network that's helping connect people where they are, not just those people who end up showing up in the hospital rooms or in the clinics, right? We need people to be able to connect to the care needed from any portal, right? Any nonprofit, any services that we provide.
So is it important that many of these people, when they are getting the services that they need, do they have to have some sort of insurance or healthcare coverage? Medicare? Is there any kind of restriction when it comes to that?
Not at all. The only thing they need to do is to be able to consent that they
Oh,
will be able to have their information
okay.
shared between partners that are on the platform.
Okay.
This is someone who is maybe only needs to provide their name and the zip code in which they live and their birth date, right? So all of the identifying questions are very streamlined. I mean, obviously, the more information we have on each client, the better, because then our demographic reports are filled out and we get a little bit more understanding of what's happening. But certainly, it's not required at all. Just that they can attest and say that, yes, you can share my information because we're going to send it over to Food Share because they're going to help me with my food needs, or up to Senior Concerns because we have a homebound senior that needs help. And so there's so many different applications. Absolutely.
So let's talk about the age range that you cover. I mean, I'm assuming you do cover, of course, many adults and seniors, but what about children?
Absolutely. Yeah, no, kids as well. And from the family service providers, we have the Partnership for Safe Families, who runs our child abuse prevention council. It's a fantastic group of organizations, and they are working within the ACES platform to work and utilize the network to help connect all of these agencies and service providers that are helping these kids get the tools they need to become great humans.
So basically, in your role, you go out into the community and you deal with many of the nonprofits that will be an arm of help to many of these people.
Exactly. So in an ideal world, Sandra, we are getting every single nonprofit organization and healthcare agencies and government agencies as well. Actually, the county, we're working with them as well, working to see if that will work within their program area. But it's really important because the more agencies and social service providers you have on the network, the more robust you can imagine it becomes. You click on the network, oh gosh, I need help in employment services. And you click on the link and, oh my goodness, we have 5 different providers and here are their locations. And, so you can really drill down and specific help. It's immediate. Within 2 days, referrals are closed and accepted. So the communication, I'll give you just a quick example, is that, so for instance, when COVID hit, we had such a non-communication with some nonprofits that were no longer open, and so we're sending referrals. We have case managers sending referrals to different nonprofits, but they weren't being received, or they didn't know that if they were received or if the cases were closed. There wasn't that instant communication. That is that feedback loop that really is critical to us all working together for that client's health needs.
So I think the next question I had was, how would somebody access the services of your organization? I mean, is there a place that they would have to go to, or how exactly would someone get the services they need?
Right. Well, the first thing we encourage people is to come to the website. Now we have UniteUs.com, and that's our large overarching website of our organization. But we also have Unite California, which really refers to the network within California of all of the different organizations within our more local area. So you could, again, I would just Google Unite California or Unite Us, those 2 areas. I wanted to also just quickly let you know that we do have every Wednesday community information sessions. So you can click the link, and I will be able to send you that information about when those are and how we can help get you on the platform.
Okay. I also just wanted to touch on this real quick, that, we here in California have experienced many disasters. And I just wondered if this organization, Unite Us, also aids when disaster strikes. Is that something that this organization will help many people when they are in need?
Absolutely. I mean, we have So many organizations that are right up in front
Yes,
when we have a disaster. You've interviewed quite a few of our
right.
first responders, wonderful interviews, and so proud of what we do here. But we know that we can be better. We
Okay.
know that if we have the great services of 211 and the services that we're providing already through the county, that we can connect those and utilize this tool to help make it easier and more real-time solutions right away, as opposed to a lot of the delay that a lot of our traumatized citizens were finding, that they
Right.
had to wait for services because there just wasn't a great communication tool to be able to connect them right away for the things that they needed. And so we do find that this is going to be just a great tool in
Good.
if and when the next disaster would hit our town.
Very good. Well, I would like you to share the website one more time, any contact information that people interested in reaching your organization can access.
Right. Again, uniteus.com or unitecalifornia.com. You'll get the same information to
All right.
both places. Also, my email, please feel free, is Jill, Jill, .Shaffer, SHAFFER, @uniteus.com. And I'd be happy to set you up with that information session or give you any information that you'd like.
Very helpful to many, many people out there. So it's
Oh,
good to hear about the organization and all that they're doing. I want to thank you, Jill Shaffer, Community Engagement Manager at Unite Us here in Ventura County. Thank you so much for sharing all the good information. Many people will appreciate it, I'm sure.
my pleasure.
Great. Thank you, everyone, for joining us on the show today. We look forward to seeing you next time. Bye, everyone.